Bismillahirrahmanirrahim. Rabbi Zidni Ilma. Sometimes life doesn't give you what you want, not because you don't deserve it, but because you deserve more. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq, and under the supervision of Professor Sarah Afzal, today my topic of presentation is formulation and historic perspective of health policy of Pakistan and policy standardization. Learning outlines include the introduction to health policy, the purpose of health policy, formulation of policy in Pakistan, historic perspective, Pakistan's various health policies, and policy standardization. Learning outcome. At the end of this presentation, participants will be able to describe the health policy, its purpose, formulation, and historic perspective of policies of Pakistan and also policy standardization. What is health policy? Mosby's dictionary defines health policy as a statement of a decision regarding a goal in healthcare and a plan for achieving that goal. For example, to prevent an epidemic, a program for inoculating a population is developed and implemented. According to WHO, it has been defined as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Harvard Medical School describes several categories of health policies, such as personal healthcare policy, pharmaceutical policy, policies associated with public health, such as vaccination policy, tobacco control policy, and breastfeeding promotion policy. Spectrum of areas covered by health policies include the financing and delivery of healthcare, access to care, quality of care, and health equity. Objectives of national health policy are to achieve an acceptable standards of improved health, ensure equitable access to public health system, create new health infrastructure in areas deficient, upgrade existing health infrastructures, promote public-private partnership, suggest ways to increase investment in health, and promote stewardship in health for effective monitoring and evaluation of current policies. Health policy historical perspective. Evolution of health planning in Pakistan can be depicted by an array of milestones. These include 1943 to 46 formation of Health Survey and Development Committee. In 1943-46, although chronologically this is pre-partition, the work of this committee influenced policy in Pakistan for a number of years. 5 years plan, a policy instrument from 1955 to 1998. Then the efforts to formulate health policy 1970 to 2001. Then Almata Conference 1978, Social Action Program 1993 to 96, Millennium Development Goals in 2000, Poverty Alleviation in 1990s and onward, and the role of private sector, and the Devolution Plan 2001 and now the Devolution Plan 2011. Sorry. Formulation of health policy in Pakistan. Before 18th Amendment, process was done in Federal Ministry of Health and Planning Commission, and then the planning and implementation was done in provinces. After 18th Amendment in 2010, there is process called devolution. Then comes the National Health Vision, and the health policy is function of provinces. Now, before moving forward, first we discuss what is decentralization. It has been defined as the transfer of authority and responsibility from public functions from the central government to subordinate offices or quasi-independent government organization. You can see it is centralized and then it is decentralized, which is the so the decentralization can be considered under deconcentration, delegation, and devolution. So what is deconcentration? Which is a shifting of the powers from the central office to the peripheral office of the same administrative structure. For example, Provisional Department of Health and its district offices. Then comes the delegation, in which responsibility and authority is shifted to a semi-autonomous organization, for example, Board of Governors of an autonomous hospital. Then comes the devolution. It shifts responsibility and authority from the central offices like Ministry of Health and Ministry of Power to separate administrative structures still within public administration, such as elected local government. They may raise their own revenues and have independent authority to make investment decisions. Decentralization is expected to improve the sector performance through improving allocative efficiency, improving production efficiency, service delivery innovations, improving quality, transparency, accountability, and legitimacy, and bringing about more equity. If we see the stakeholder analysis and policy making, if we see the influence on y-axis, which is high, medium, low, and the interest, which is low, medium, high, and we can divide into group A, which is high influence but low interest. Group B is high influence and high interest. Group C is low influence and low interest, and Group D has low influence and but high interest. So all these things go side by side. Steps of health policy formulation includes the data collection from Health Management Information System, preparatory meetings, drafts sent to Planning Commission and Ministry of Finance, Cabinet, 5 years plan formulated, then the project's design, public sector development programs, then the implementation, and last, monitoring and evaluation. There are five basic criterions. The Bohr Committee report, J.W. Jockmans and Carol Beckers have discussed the appropriateness and accuracy of policy documents. On that basis, Lashari in 2004 highlighted the five basic criteria. The policy should contain number one, empirical record of the past, situational analysis slash need assessment, future plan with implementation and estimates. Evidence-based relying on burden of disease slash HIMS, then address health system with intersectoral approach, lock into cost effectiveness of goals, objectives and targets, and have a clear definition of roles of federal provision and district tiers. Now moving towards the health policies. Health Policy 1990. As Pakistan is the signatory of Health for All, it was the first national policy of Pakistan. It was focused on school health services, family planning, nutrition programs, malaria control programs, control of communicable diseases, sanitation and safe drinking water. If we see, place all the five criteria on one side and see the effectiveness of this health policy of 1990. Empirical record of past situation as in need assessment, it was not, empirical record was not done. Need assessments were done on account of problem prevailing but lack magnitude of problem. Then the evidence-based line of burden of disease was acknowledged lack of data. It was done, cost effectiveness was not calculated and clear definitions. There was no mention of rules of federal, provisional and district tiers. These were the merits and demerits of this policy. Next policy was in 1997. Social Action Plan was implemented in 1992 and the multi-sectoral policy initiative of Government of Pakistan. It was the second national policy. Health promotion and education was emphasized. Non-communicable diseases were highlighted for prevention and control measures. Again, we see it under this, in this empirical record was lagged, the figures were lagged, attention was given to intersectoral approach, the cost effectiveness and alternatives were not established, and high ambiguous targets were there. And only details of district health authority was given in this second policy. Health Policy 2001. It was to create mass awareness that public health matters and use multimedia to disseminate information. On its prevention and control aspect of non-communicable diseases, Heartfile was 2003 and National Action Plan for Prevention and Control of Non-Communicable Diseases. Now, we will see its empirical record was not given. Evidence-based was not mentioned, health system intersectoral was not mentioned in it, and cost effectiveness and implementation were not discussed, and it did not fulfill any criteria. Health Policy 2009 draft not approved, but it was stepping towards better health. The VN was to improve health and quality of life of all Pakistanis to make progress towards health-related MDGs, enhancing coverage and access of essential health services, especially for the poor, by primary and secondary healthcare facilities and the primary and preventive healthcare programs. And the measurable reduction in the burden of disease, especially among vulnerable segment of population, protecting to the poor and underprivileged population subgroups against catastrophic health expenditures and risk factors, strengthening health system with focus on resources, strengthening stewardship functions in the sector to ensure services provision, equitable financing, and promoting accountability, and improving evidence based policy making and strategic planning in the health sector. If we see the merits and demerits of this policy was health needs were identified in this policy. It was evidence-based, wider intersectoral coordination was there, implementation plan cost effectiveness was not mentioned, whereas mentioned but strict health system role not clearly defined. Health Policy 2010 could not be approved before devolution post 18th Amendment in 2010. So, the formulation of effective health policies. Literature supports that effective health policies can be formulated by doing the following. Number one is situational analysis and policy formulation, increase funding, training and capacity development, community involvement, public private partnership, stabilizing population, monitoring and evaluation, transparency, and accountability. All these factors lead to the formulation of effective health policies. National Health Vision 2016 to 2025. Background issues include the partial implementation of National Health Policy 2001 and 9, many health issues like burden of diseases, worsening of population explosion, and insufficient health system remain unsolved, plus new challenges created by 2011 health devolution, MDGs were not achieved, and SDGs, Sustainable Development Goals, were launched. VN statement is to improve the health of all Pakistan's, particularly women and children, through universal access to affordable, quality, essential health services and delivered through resilient and responsive health system, ready to attain SDGs and fulfill its other global health responsibilities. The thematic pillars for the National Health Mission are the health financing, health service deliveries, human resource for health, health information system, governance, essential medicines and technologies, cross-sectoral linkages, and global health responsibilities. And in the upcoming presentations, we will discuss every part of this. Now, according to updates, Punjab Health Sector Strategy. The government of Punjab has pursued the development of 10 years Punjab Health Sector Strategy 2019 to 28. This strategy is a sector too and is in consonance with achievement and gaps filling out from the previous health sector strategy, which was in 2012 to 20, made as a result of post 18 amendment of Pakistan and bifurcation of Health Department, Punjab. So initially there was health sector strategy, which was from 2012 to 20, and then the Punjab health sector strategy from 2019 to 28. The salient features are the maternal and child health, MNCH nutrition and family planning, preventive health services including communicable and non-communicable diseases, patient safety and quality of care, medicines and biomedical equipments, health disaster management and emergency medicine, healthcare financing and public-private partnership, HMIS, governance and accountability, and HR, human resource for health. Now, seeing the health sector strategy, SIND. The overall VN is based on health for all. The new health policy aims to implement the strategy of protecting people against hazardous diseases, promoting public health, upgrading curative health facilities, enhancing equity, efficiency, and effectiveness in health sector. Health sector strategy of Sindh from 2012 to 2020. The health sector strategy. The approved health sector strategy framework of SIDH is expected to serve as an overarching umbrella for guiding optional plans of medium and long-term projects and programs. And all the, the strategy also has been developed to identify requirements for health systems strengthening in Sindh. Strategic outcomes focus on strengthening district health system and human resources, regulating private sector, utilizing innovative financing schemes, and responding to steward and governor role of the government. Health sector strategy, Khyber Pakhtunkhwa. After devolution, Khyber Pakhtunkhwa is the first province to develop a health sector strategy 2010 to 17, entailing a responsive health system to improve the health status of the population based on prioritized outcome. It approaches focus on enhancing coverage, improving human resource management and governance, and regulating the health sector. If we see the potential funding share of priority health development is 54% is by the government, and by donors it is 46%. The health policy was prepared in the view of the key issues related to health status of the population, intersectoral coordination, priorities of current government and health sector, achieving health-related SDGs and universal health coverage, national priorities in health sector. Health sector strategy Balochistan. This is a well and healthy Balochistan. It's the logo and the health policies from 2018 to 30. Initially, there was health sector strategy was from 2013 to 18, and now it is from 2018 to 2030. This was preceded by review of literature published as well as grade to establish policy context. The policy has been developed through a consultative process involving stakeholders, and for that field visit, individual meeting with key informants, group meetings, and focus group discussions were held. The principles of health policy was embedded in National Health Vision 2016-25 and the Sustainable Development Goal 2030. The health policy document will provide direction and serve as a long-term plan for health system strengthening. Health sector strategy Gilgit-Baltistan. It is a regional RMNCA, reproductive, maternal and child health care and nutrition strategy 2016 to 20, and the national vision for the 10 priority action to address challenges of reproductive, maternal, newborn, child, adolescent health and nutrition. Summary: the first policy was in 1990, then in 1997, then 2001, then 2009, and the devolution occurred in 2010. And National Health Vision is now being implemented in 2016 to 25, and there are provisional policies. Now moving towards the policy standardization. Sorry. Standardization in healthcare is often defined as the process by which healthcare products and services are chosen by a committee of key stakeholders considering evidence-based results to ensure quality patient care while adhering to fiscal responsibility. Standardization, especially in healthcare, minimizes the risk of errors, increases patient safety, and can actually improve the patient experience. One of the articles, standardization in health insurance, in which they mentioned the plans are now sold through health insurance exchanges, either set up by state or run by the federal governments. Plans are differentiated by metal tiers such as bronze, silver, gold, and platinum, depending upon how generous they are in their coverage. These variations in benefit design can have significant consequences for consumers in making optimal plan choices, spending out of pocket, and assessing care. Cost sharing amounts and the applicability of the deductibles to service have a large impact on a consumer's bottom line as well as access to care. The available evidence shows that consumers are adversely impacted when faced with choices that are too complex and too numerous. Instead of allowing insurer to offer a vast range of plans, plan standardization streamlined decision making to the benefit of both the consumer and insurance. Why to standardize? The Affordable Care Act ACA created health insurance exchanges in every state to encourage insurers to compete based on price and quality. The exchange were required to maintain websites where consumer could make apples to apples comparison among health plans and shop with confidence that the plan available had been certified as meeting a minimum level of comprehensiveness and quality. States were given the primary responsibility to certify that participating health plans meet federal standards, as well as given flexibility to set additional plan standards of their own, such as requiring insurer to offer plans with standardized benefit designs. Now moving towards the multiple choice questions. Number one, a medical intern is doing observership in DHQ in Punjab province. He is interested to know who maintains the supply system of drugs and primary and secondary levels in Pakistan. Drug supply systems are maintained by national level, provisional level, international level, or by World Health Organization.
B.
Yes,
B.
the correct answer is B. Neonatal mortality rate for Pakistan is 41.2 deaths per 1,000 live births. World Health Organization wants to sign an agreement that will help people Pakistan to reduce neonatal mortality rate as Pakistan the highest NMR in the world. The agreement is a function of national level, provisional level, district level, or union level.
A.
Yes, the correct answer is A. A country transfer maternal and child health centers to an organization which is semi-autonomous board of governors for the service delivery of maternal and child centers. Which form of decentralization is this? Deconcentration, delegation, devolution, demographic dividend.
B.
Yes, the correct answer is delegation, in which there is a board of governors and it is one form of the decentralization. BHU serves up 25,000 people with basic medical and surgical care, preventive services, maternal and child health care services. Financial management of curative and preventive services at basic health unit in Pakistan is being managed by national level, provisional level, international level, or by World Health Organization.
B.
Yes, the correct answer is it is being done at the provisional level. Health Policy 2009 was made according to need assessment, addressed health system in intersectoral approach, and discussed cost effectiveness of goals, objectives, and targets. What it not implemented in Pakistan because of lack of political will, international pressure, devolution, or delegation?
C.
Yes, the correct answer is C. In Pakistan, health system management and decision making has been transferred to district level and executive district officer. EDO can hire management, manage budget and service provision. Which type of decentralization is this? Deconcentration, delegation, devolution, or demographic dividend?
C.
Yes, the correct answer is devolution, which is done at district level. Maternal mortality ratio is a key performance indicator for efforts to improve the health and safety of mothers before, during, and after childbirth. A public health professional team wants to design a policy to reduce maternal mortality rate in Balochistan. What should be done in first policy making? Empirical record of past and need assessment, intersectoral coordination, financial approval by Ministry of Finance, or 5-year projects should be made.
A.
A.
Yes, the correct answer is before making anything, the first is the empirical record of past and need assessment is being judged. National Health Vision 2016-25 is to improve the health of all Pakistan, particularly women and children, through universal access to affordable, quality, essential health services and delivered through resilient and responsive health system, ready to sustain SDGs and fulfill its other global health responsibilities. It is done at what level? Provisional level, union level, district level, or tehsil level? C is the
C.
yes, C is the correct answer. It is done at the district level. A policy established and carried out by government goes through several stages from inception to conclusion. Public health team XYZ has developed public health policy according to guideline. During which one of the given phase most challenges are faced? Policy development, policy implementation, policy evaluation, or policy monitoring?
B.
Implementation.
Yes, the correct answer is B. The policy implementation is a phase which faces the most challenges. Decentralization of health system has played an important role in health system of Pakistan. Which of the following is incorrect regarding decentralization? Improves allocative efficiency, improves quality, service deliveries according to equality, increase production efficiencies.
C.
C is the right option because it is done according to equity. This is my key, and thank you so much.